Welcome to this video on ultrasound probes and manipulation. Let's start by going over the different kinds of probes. These are the three main ultrasound probes you'll use in an ICU: the vascular probe, the abdominal probe, and the thoracic, also known as the cardiac probe. Each of these find a different use in the ICU. The ultrasound screen will show a different footprint corresponding to the probe that is selected. Also note that the selected depth of scanning is shown on the screen. You can adjust this as needed. Let's go on to the different planes of manipulation of an ultrasound probe. These movements are important to know for a couple of reasons. One, we will be using these to obtain and optimize our images while scanning. And two, for me to teach without touching the probe, this communication of movements is extremely important. Let's start by identifying the orientation marker. This corresponds to the orientation marker on the screen as shown on the right. You may need to change the orientation on the screen depending on the exam you are performing. To understand the planes of movement, let's denote an X and a Y axis. This motion being demonstrated is called fanning, performed by adjusting the tail of the probe in the X axis. This motion is called rocking, and is performed by adjusting the tail of the probe in the Y axis. Rotation is either clockwise or counterclockwise. Physically moving the probe along the Y-axis is called sliding. Physically moving the probe in the X-axis is known as sweeping. Those are the ultrasound movements that you need to know to get started. Thanks for watching.